Hi, my name is Elise, and today I'm going to be going over with you congenital chromosomal defects. Did you know that in an average human cell, there's actually 46 chromosomes, and when they're bonded together, they form a total of 23 pairs? But sometimes this is not always the case, and as they combine, there can be abnormalities. So we're going to take a look here at the types of mutations. There's monosomy. This is when there is a pair that goes missing. Then there's trisomy when there is an extra pair added to the mix. This creates 47 chromosomes altogether. And then there is translocation. This is when there's a pair exchange that occurs and they switch from one to the other. So in this presentation, we're going to be going over trisomies when there is an added chromosome. Looking at trisomy 13 first, this is called Pateau syndrome. This occurs in 1 out of every 10,000 births, and 10% live past the 1 year of life. So you can take a look here and see this is what a child at live birth appears as and looking at it in the ultrasound. So children born or even created in the fetus in this situation are likely to suffer heart defects, brain or spinal cord abnormalities, very small or poorly developed eyes, extra fingers or toes, and an opening in the lip, shown as a cleft lip in these images, sometimes leading to an opening in the roof of the mouth as well, and they have weak muscle tone. So due to the presence of these types of life-threatening medical problems, many of these infants die by their first few days or first few weeks of life, and only about 5 to 10% will live past that first year. This is also seen in the next case, in Edwards syndrome, trisomy 18. This is occurring on a different pair, but still an added chromosome to the mix. This occurs in 1 out of every 2,600 births. This appears more common because they're looking at the ones that are live births, but if you're looking at ones that do not make it to full term, it would be 1 out of every 6,000. So same thing, 10% live past their 1 year of life. And in a majority of these cases with trisomy occurring, it's because of the maternal age. When the mother is giving birth over the age of 35, it's much more likely to occur. Same types of abnormalities are seen in this type of trisomy. So you can see here all the same cleft lip and those hands that are forming incorrectly inside the womb. Then we're going to take a look now at Down syndrome. This is trisomy 21, which is much more common. This occurs in 1 out of every 691 births, and 80% of the women actually that are having birth over the age of 35 have the likeliness of this happening to their child. However, it is an interesting fact that if you do have a child that is born with Down syndrome, there's only a 1% chance that the following child or any child after that would have the same type of syndrome. Now, in this case, you can see here it's still shown in the fetus even prior to birth. You can see how it's developing and all of these changes in appearance. So obviously they do suffer physical and mental abnormalities. But in this case, as you guys know, people can be born with Down syndrome and still function in full life. It used to only be up to the age of 25. But as you can see here, she's a teen and then into adulthood. The average lifespan is around 60 years old. So now I have a video I'll have you guys watch. This is of somebody that is suffering from, well, actually, he's not suffering at all. What am I saying? He was born with trisomy 18, and incredibly enough, he has some really great things to say. I appreciated this video a lot, and I hope you guys do too.
Hi, Mr. Dawkins. I was away when you made your comments about Down syndrome babies. But I'm here now, and I definitely would like to say a few words about how I feel about this whole situation. My name is Brent. No, I do not have Down syndrome, but I do have mosaic trisomy 18. I'm sure you've heard about it and the bad rap that trisomy 18 gets, with the whole incompatible with life label. First of all, I guess I'm a little confused about your comments. Abort it and try again? Or that's even more for parents of a baby born with Down syndrome to not kill the baby. I really don't understand this, so maybe you could clarify this for me. Why my life and the lives of Down syndrome kids are less valuable than yours. I see that you made this comment from your own moral philosophy, which is a desire to increase the sum of happiness and reduce suffering. Hey, I kind of like that philosophy. I think I'll use it when I have to do my homework, or I'm asked to do my chores around the house. Sorry, Mom. I have a desire to increase the sum of my happiness. Right now, reduce my suffering sounds good to me. I'm thankful that my mom did not take your moral or sensible advice to have an abortion. Because, Mr. Dawkins, I believe that genetic discrimination is deadly. We all deserve a chance at life.
I hope this gave you guys some insight on trisomy 18 as well as all the other cases that it is occurring.
Hi,
Thank
Mr.
you
Dawkins.
so much for watching my presentation, and here are my references. Thanks so much.